Welcome back, everyone. For this Health and Happiness podcast, I'm Dr. Farzanna Haffizulla.
Chinese medicine is amazing. It really is. It's coming, I think it's coming more to patients' recognition. Medicare is finally approving it for low back pain.
Wonderful.
So finally, we get a lot of calls. Unfortunately, it's not covered by the majority of insurances, which is the barrier. Not everybody could pay for the sessions. Mm-hmm. So TCM, Chinese medicine is amazing. My next one on the line would be sound. Yes. I work a lot with sound bowls.
Fantastic.
Our bodies are frequency, right? Every cell in our body has a different frequency. Everything we do has a frequency.
Very much.
So we need to be at a certain frequency in order for disease not to come into our body, right? So
exactly.
Depending on the vibration that we're resonating, it'll either fight off or bring in. Mm-hmm. So if you're vibrating your body at a certain frequency that's very low, you have more chances of getting infections, more even cancer. And then the higher frequency you are, the more resilient you are.
Yeah.
So for me, sound healing is amazing. It's something I incorporate into every treatment. When I see a patient, we have sound. We have red light therapy is another thing that we're using now.
Wonderful. So you combine all these. I think I did see a little bit or hear a little bit more about the red light therapy. Can you tell us a little bit more? I know that's also for anti-aging. People look at it for the skin changes and all of that. Can you expand on that a little bit more? Because that's been all over the news and, a lot of people
it's interesting because a lot of people are using it for anti-aging because, it works with the mitochondria.
Yes.
So it's all about the mitochondria. I was at a longevity conference a couple months ago, the A4M, and the whole topic on every speaker was about the mitochondria because everybody's going back to the cellular level. Mm-hmm. But red light therapy is phenomenal. You just need to do it 2 or 3 times a week. So it's hard. Again,
yes.
How do we, unless you have one in your house and you're able to do that all the time, I offer it to our patients. They come in, we get it done. Does it help? Maybe. Mm-hmm. For pain, it's very good too because it helps with the inflammation.
Fantastic.
Because we have the infrared and the near infrared, which work at different levels.
And this is whole body infrared?
Whole body.
Whole body.
Yeah.
So not just the face, not just one part of the body. Do you have benefit, though, if you concentrate it in one area of the body?
Yes, they have. Okay. They sell the face masks.
Yeah.
My kids got me one for Christmas because they know I'm the anti-aging.
Yes.
I love all this stuff. So they got me one for Christmas. So I wear it when I remember.
Right.
At least once a week, I put on the mask.
So physiologically, what's happening when we use red light?
It stimulates collagen also.
So collagen, you mentioned reducing inflammation.
It does. It reduces inflammation. It works with the mitochondria.
Excellent. And we know inflammation is like the crux of many disease states, right?
It is. I think all diseases.
Yeah, exactly. So what about those infrared saunas, that have red light therapy and it's infrared heat as well? How does that factor into longevity? And I'd love to talk a little bit more about on the longevity side of things too.
Well, the good thing about the sauna is that you are detoxing also because one of the things another pillar is detoxification.
Yes.
Because we don't detox enough. So the infrared sauna is amazing for that. Mm-hmm. And if you have red light in there, you're doing a synergistic effect. So you're getting a 2 for your buck.
Yeah.
So there's a lot of centers that provide the sauna with the red light therapy.
Excellent.
Yeah.
And is there a specific amount of time that you should be in there? You said 2 to 3 times a week or 3 to 4 times a week or so forth.
I have some patients that do sauna every day.
Wow.
And I don't know how they find well, yeah. But I mean, they find the time.
You find the time. You need, 20 minutes in there?
20 minutes.
About? Okay.
Depends on the temperature. You don't want to go too high or too low.
Exactly.
But they have amazing infrared saunas.
Excellent. So how does that compare to cold plunge?
I personally don't like cold plunge. Okay. 2 reasons. One, I have cold-induced urticaria, so I cannot do that.
Then definitely not.
But
yes.
in Chinese medicine, we learn that cold stagnates. What that means is that it constricts.
Okay. Yes, of course. Mm-hmm.
So when you have, especially for women, cold plunge is not recommended because of the cold uterus.
Yes.
Anybody who has fibroids, anybody who has PCOS or endometriosis, anything like that, you do not want to do cold plunges. It's totally, in Chinese medicine, it's looked at like, no way.
Is there any place for it that makes sense?
Athletes do it, and it's great. And for recovery, it's very good.
Mm-hmm.
I don't have nothing against it. Personally, I recommend it to athletes all the time.
Yes, exactly. Well, let's talk more about the detox side of things. You mentioned, the sweating from saunas and the red light therapy and so forth. How else? We're surrounded by so many different toxins and chemicals. We're literally, it's hard to avoid any of it, right? So how can we navigate that and detox naturally?
Well, it's hard.
It is.
Because like you mentioned, we're breathing. Right now we're breathing.
Yeah.
So one of the ways through the breathwork. That's where breathwork comes in also.
Excellent.
Breathing in, exhaling, breathing out longer. The breath, the sweat, and the poop.
There you go.
And a lot of people have issues with that because people do not go to the bathroom. Constipation is so high.
Yeah.
That's another thing that I see a lot. People are not regular enough. Mm-hmm. And again, it goes back to the diet.
Yeah.
Are you eating enough fiber? Are you eating enough vegetables and fruits? Probably not.
That's right.
Are you drinking enough water? Because that's the other thing.
That's right. And moving.
And movement.
Yeah.
Going back to the beginning, to movement.
Yeah.
So there's a lot of, so for me, detoxing is very important because, again, the air, the water we drink, I recommend people testing their water in the homes because you're in there, you're drinking, you're showering, your skin is your largest organ. So you're going to absorb the water that's coming in out of that shower. You're going to be soaking in a tub with God knows what, unless you have that water tested.
Now, how do you test the water? Do you have a specific
There's companies that come out and they test it.
Wonderful. That is a very important point. We don't think about these things.
No, we don't.
We're really immersed in all of these chemicals and toxins all the time.
And then for us women, makeup, lotions, perfumes.
Yeah.
If you look at the labels, I get crazy sometimes. I look at that, I'm like, oh my God, do I really want to put this on my body? No.
It's like an organic chemistry textbook, right?
Yes. It's like, what? No.
Exactly. Well, listen, I did a small part. I stopped any color in my hair. I've embraced my natural grays. But then you said, you're right, makeup and all the other things around us. We have to think about those things, right?
So one thing I recommend to everybody, there's the environmental work group. Mm-hmm. They have a very good website. They have an app. And you could look up anything, whether it's cleaning. Oh, that's the other thing. You clean your house. What do you clean your house with?
Right.
What kind of materials are you inhaling? Do you use air fresheners? Those are like the worst with the VOCs.
Yes, that's right.
So all these things you could find on that app or on their website, and you could put in Bobbi Brown or Chanel, whatever makeup you use, and it'll tell you what the rating is.
So for our viewers, environmental working group.
EWG.
EWG, just look that up and plug in your product names, right? And you get basically a little, it tells you everything that's in it.
It'll tell you rating from 0 to 10. How toxic you're putting on, how toxic do you really want to, it's an eye-opener for a lot of things.
We will write this down.
It's really good.
Environmental working group, everybody. That's a pearl of wisdom right here. That's excellent knowledge. Yeah. We could see exactly, get a good, not only bird's eye view, but a deep dive into what's around you, what you're immersing
because you don't think about the shampoo, conditioner, all these things are going on your body.
Exactly.
And then you're wearing them for long periods, especially like makeup, women, creams, lotions.
Yeah.
All these things are toxic.
Exactly. And I want to go back to the food piece, and we talked about organic food, etc. Is organic really the best type of food, or, what should we look out for? Because I know that some folks, the way they label the foods, can make you think that this is the healthiest and best option for you, when it really isn't. It was exposed to so many pesticides and chemicals. You shed a little bit of light on that with your expertise, Dr. Junco.
And this is one thing with organic foods. You really don't know what you're getting.
Yeah.
It could say organic, and it could be in a farm, and 5 miles or 2 miles down the street, there's a non-organic farm. The same water is feeding both of those soils.
That's right.
So sometimes if you could do organic, especially like smaller things like berries and strawberries, things that are more prone to pesticides. But if it has a peel and you could peel it, you don't have to. I would not. I mean, especially if money's an issue. Yeah. You could go buy with non-organic.
Right,
like bananas. You have to peel it, like a banana, things like that. But for like berries and things that are going to absorb all those wonderful things, yes, you don't want to. You want to try to stay away. But again, it's hard because you don't know what you're getting. Is it really organic or not?
That's right. Well, you do a lot of work as well, too, in our medical mission trips, international medicine trips, and you're bringing this knowledge to different communities around the world. How is that a different experience, compared to when you're seeing patients here? What do you have to change, or how do you approach a patient in that environment?
Well, first, we're really fast-paced there because
Yes.
we saw 1,700 patients
Amazing.
in February
Incredible.
in the Dominican Republic.
Incredible.
In 5 days. So it was pretty nonstop. But
Yeah.
one of the things we address with nutrition is first what kind of food they're eating in that island. Like, what is their staple food?
Exactly.
In the Dominican Republic, it's very starchy. So you're going to see more metabolic disease. I mean,
Yeah.
that's one of the main things we saw. Hypertension, a lot of salt.
Diabetes.
A lot of
Yeah.
diabetes. So we address things in that way first. Trying to figure out what is it that they eat the most of. Carbs. They can't afford protein,
Yes.
which is sad.
A lot of proteins are plant-based as well. you know?
Yes.
And so do you, of course, share some of that information and see perhaps if there are local farms or other areas that people can have access in that community?
Yes, but it's so scarce.
Yes, of course.
Unless they could get legumes and things like that are more accessible, probably. One of the things that I do tap into with them, which is fascinating, is their knowledge of herbal medicine.
Yes.
Because that's another one that I love, especially in these islands. Because
Yes.
they're taking, I had a patient, this was in Galapagos, so, boiling the guanabana leaves, soursop. And it's anti-cancer. Those studies have been done.
Incredible.
If you have a bacteria, oregano.
Yeah.
So I love listening to the patients and getting their history, because a lot of them come in, they don't want to take a medication because they know we're going to give them a medication. It's not going to be sustainable. So it's interesting to listen to see what they're getting from their own backyards.
I love that. And that really falls into our work here on this particular channel, not looking at the Caribbean and Latin American communities, but also, communities who are historically underserved or vulnerable in any capacity. Herbal medicine is a very big part of, what's used, as you said, rather than pills and other prescribed lotions and potions and
Right.
things like that. So let's talk a little bit more about some of those health benefits of some of the herbs. You mentioned oregano. Are there any other herbs that you want to highlight? There's a lot of cilantro that's used.
Oh, yeah,
and
cilantro.
Rosemary and all of the
Rosemary's
other ones.
great. It's great for the brain. One of the board exams that I took was in herbal medicine for Chinese medicine during my master's, and
Yes.
we had to learn so many things about every single herb, because Chinese, for the Chinese herbs they use everything, not just not
Exactly.
just plants. So we had to learn everything, and it's just fascinating. But rosemary's great for the brain.
So
People
dementia
don't-
patients?
Dementia, yeah,
Any-
memory,
anxiety, depression.
any
of those
anything's
things?
good for the brain.
Fantastic.
All that's great. Oregano, again, antibacterial. Soursop, anti-cancer, it's anti-inflammatory, it has high antioxidants. Avocado leaves, and it's beautiful because it's not only you could use the seed as one type of medicine, you could use the leaves, and you could use the fruit.
Incredible.
Same thing with mango leaves, the seed. I mean, everything has a property. Everything is going to have a benefit.
So we'd love to read your book then, okay? We know you're going to come out with a book with all of these pearls of wisdom.
I wouldn't know where to begin. There's so much.
You've just got such a wealth of information. I can't wait to dive even deeper. We've covered so much ground already. It's incredible. So do you have any other patient stories that you'd like to share, or pearls of wisdom that you'd like to share with our audience base?
Well, what I just want to say is life on this earth, we don't know how long we're going to be here. And making the best out of it every day is what's key. And it's not about, I think health is not just about, being illness-free. It's about being able to move, being able to see your family, being able to dance at your great-granddaughter's wedding, to be able to longevity. And how can we get there? There's certain things that we need to take into account. We have to be mindful of everything we're doing. We need to stop and think and just take a deep breath. We forget to breathe. We breathe because we're alive and we're breathing, but we really don't get into our breath. So breathing, being moments of gratitude, being grateful. And in the morning when you first wake up, just take a moment and be intentional. What are you going to make a difference in somebody's life that day? I like to always wake up and say, okay, how am I going to make a difference or make an impact on somebody today? And then do my breathing exercises, do your meditation. And before you go to sleep, same thing. You just lay down, do some breathing exercises, and just do a moment of gratitude. What am I grateful for today? What did I do today? What am I grateful for? Because we have so much to be grateful for in this world. And it's just trying to make life the best for us and those around us.
I love that. That is absolutely beautiful. It warmed my heart and my soul just hearing you really anchor everything with gratitude. You know, it is a gift to be here. And we're here for a purpose.
Indeed.
And everything around us will help and heal us if we give it an opportunity to do that.
Right.
You know what I mean?
For sure.
So thank you so much. Do you want to share a little bit more about the breathing exercises for our audience so that they know exactly how to do that breathing exercise?
Sure, we could do a quick one.
Yeah,
so
absolutely.
One of the things, there's so many breathing exercises. You know, there's the prana, the nostril breathing that they do in yoga.
Yeah.
One of the ones that I recommend is from the father of integrative medicine, which is Andrew Weil, and it's 4-7-8. So you're going to breathe in through your nose for 4. You're going to hold it for 7. And then you're going to exhale slowly through your mouth for 8. And then you're going to repeat that at least 6 or 7 times. And the beautiful thing about that is that on the expiration, when you exhale, is when the healing happens, because that's when you activate your diaphragm, which is going to be the main activator of the vagus nerve. So it's beautiful. So with that, we breathe.
I love it, everyone. You hear that? With that, continue to breathe.
Yes.
And hopefully you're listening to this podcast as you're walking outside in the sun.
Yes, in the sun, smelling the flowers.
Smelling the flowers, appreciating the beauty around you.
Yes.
And when you come back to your home base, you have a colorful bowl of vegetables and fruit waiting for you.
Indeed.
Together we will help and heal. Well, Dr. Junco, thank you so very much for joining me today. You shared you're a wealth of expertise in all of these different areas.
Thank you.
You're sharing these beautiful messages with our community. We are grateful.
Thank you. And I'm grateful to be here and be able to make a difference in everybody.
Well, we love it. Well, you're a woman of the world and
Thank
a physician that we adore. So we appreciate you. You have to come back many times.
Yes.
Okay?
I know it was a lot of information, but it's overwhelming. We could go on.
No
just
worries. We slow it down, replay it,
All right.
however you'd like to. Digest it on your own time.
No stress.
No stress.
No.
Exactly. We live in gratitude,
Yes.
respect, and we'll honor the information. So thank you, everyone, for joining us for this episode of Health and Happiness. Please join us again soon. I'm Dr. Farzanna Haffizulla. Take care. If you're viewing this QR code on your phone, an easy way to access the link is to take a screenshot of it and then long press the QR code from the screenshot picture. Your phone should recognize it and take you straight to the video.